Dr. Rob Silverman here. I just finished my first webcast, Proven Health Alternatives. It was my pilot. It was outstanding. I had Dr. Jacob Harden, rehab expert, and he shared some great takeaways. He spoke about treatment and treatment with optimization of movement. He spoke about the missing links in rehab and how rehab functions within a chiropractic practice. And he shared how he got 445,000 Instagram followers. We've got a great guest, Proven Health Alternatives, Dr. Jacob Harden. I met Dr. Harden in a seminar. Let me tell you a little bit about this guy. He's a chiropractor like myself from Orlando, Florida. He specializes in movement rehab and injury prevention. He has a seminar series, and it's called Prehab 101. And he teaches seminars on rehab and injury risk reduction. In addition, this dude is an Instagram star. He's got 450,000 followers. Dr. Harden, how you doing?
I'm great today, man. Thank you so much for having me on.
Oh, my pleasure. It's great to chat with you, man.
Yeah, I'm excited. This is going to be, these are always really fun to do. I love getting on and just like chatting about all the different topics in our little world. So.
Absolutely. I mean, it's funny that I think the knowledge that you're going to be able to share with everybody is going to be so valuable. And that's why we're doing that. We just want to get out. We want everybody to know what chiropractors and chiropractic rehab can do and how they can share it with everybody. There's a lot of misinformation there. So let me segue into injury prevention. It's truly a hot topic. So the real question is, I had some questions for you. Can we prevent injury, or are we just reducing the risk?
We're just reducing risk. And the reason I say that is because no matter what program you go through, no matter how strong you get, how in shape you get, you can still step off a curb wrong and roll your ankle, right? Like you can still have a 300-pound linebacker come barrel into your knee and hurt your ACL. So we can't prevent injury. I can only say that we're just kind of raising the ceiling before it happens. So the more resilient we make our bodies, the more activities we're kind of encompassing that can't hurt us. So, if you're doing deadlifts and you're getting really, really strong at that and you're building up the strength in your lower back, you're reducing the risk that the next time you move your couch, you're going to hurt your back, right? But it doesn't mean that if you went and you tried to pull 1,000 pounds off the ground that your back's not going to get hurt. Like there's still a ceiling, there's still limits, and we have to keep that in mind. And that really is kind of a language thing to make sure that we're not setting some false expectations for people. But we're definitely not preventing, we're just reducing risk as best as possible by trying to optimize as many factors as possible.
Interesting. Great takeaways. So if I were to ask you a couple of ways to reduce risk, what would you share with the viewers?
Well, the way that I work with it is I have basically 4 things that I'm really looking at. And I kind of shape them like a pyramid. So at the base of your pyramid is stress management. You have to manage the stress and the load that's being put on the body, because that kind of comes back to what we just said. That 300-pound linebacker can always come barrel into that knee, and that's going to be a high load that you're just not going to be prepared for. But we want to prepare for the loads that we can handle, such as taking that kind of same ACL example, the female athlete who jumps and lands in huge knee valgus. Her knees are basically knocking together every single time she comes down. If we can make her a little bit more resilient to that so that she can better handle that load, or we can optimize the mechanics a little bit so that she lands in a position that doesn't put as much load onto her knees, then that's going to reduce that risk a little bit. And I think that point is the point that a lot of these maybe injury prevention programs kind of miss out on, is that kind of load management side of things, which is probably the biggest piece. And that's why I kind of put it at the base of the pyramid. The next level up from that is a term I kind of call movement efficiency, meaning I want you to really, how are you moving? Like mechanics do matter. And especially as we get to higher loads, mechanics matter a lot. And we want to make sure that we're moving optimally when the situation calls for it. Also making sure that you have proper mobility in all your joints. So making sure that you can move the way you want to, because if you don't have the mobility in the joint that you need to, then you're going to have to compensate around that in some way. You then can't control your movement, which then means you can't control the load and the stress you're placing upon the tissue. So that's like the third level. And then the fourth level is that you have to be able to recover from all of it. If you're not recovering from all the stress you're applying, then you can't get stronger. You can't get in better shape. You can't push that ceiling higher. And so we need to factor in all of these things. And when we do that, I think we're creating it's a principle-based system, but it's one that we can apply across a multitude of different situations in order to start reducing risk very contextually and very individually.
So you really talked about optimum movement. And what I really liked to talk about was the ACL. So many people in rehab, they tear their ACL. Women are more susceptible to an ACL tear. Valgus, that coming in of the knee, really puts that strain, like you said, on the tearing. So that's how that I just gave you an idea for your Instagram, which is dr.jacob.harden, where you just tell some people what you're doing there, because it comes right into that, where they can go. You're a source for all these type of exercises and rehab exercises.
Yeah, so the information that I'm trying to put out online is really built amongst those 4 principles. And, that from the preventative side of things. I'll do some rehabilitative strategies as well to help out with my docs and everybody who may want something to help a patient. But from that preventative side, that's everything that I'm really trying to tell you, which is manage the loads that you're putting on top of your body. I'm trying to teach you proper exercise technique. But on the flip side of that kind of, I said that term movement efficiency. Mm-hmm. Efficiency means to use as much energy as necessary, but no more than necessary. So this can the great way to kind of think about that is the spinal flexion debate, which is if you drop your pin on the ground right now, do you need to go through braced core, hip hinge, grip the ground, straight spine, all this in order to pick up that pin? No, that's very poor efficiency because the load and the stress on your body is so low. So, but what you can do is you can just bend down, pick it up in really any way that you want to, meaning it's not bad to flex through your spine to do that. The spine was meant to move.
McGill, I'm not trying to interrupt you. I know it's such oh my goodness. We'll be here all day now.
Right. Like I can go, believe me, I can go all day with that. There are a ton of
people who say no flexion in the lumbar spine, everything hip hinge.
And meanwhile, the facet joints line up like this. It's not like your spine's not built out of a femur. It was built out of individual bones.
So I know you see a term and you've used it, and I think what you're referring to is optimum movement. Mm-hmm. So So optimal movement. So that's kind of the other side of this efficiency standpoint. So just like we said, it's okay for you to move any way you want to if you're just picking up the pin, as long as it doesn't hurt, right? Go do whatever you want to. Because on the flip side of that, there's a proper and probably an optimal way to go and pick up 500 pounds off the ground. And that is load into your hips, straight spine, braced core, all that stuff that we learn for a proper deadlift. That has to come in contextually for these higher stress situations. And really what I want people to get across here is that if you really start to see the context, we can start to have better conversations amongst ourselves and our patients. Because that's a hard conversation to have a lot of times with the patient of, okay, I want to get them to understand that right now I need them there's a time and place to use this straight spine kind of lifting mechanic. But over here, I want them to understand that I'm not telling them that they can't bend through their back, right? Or if they're having a bout of low back pain, it's better for them to keep the spine straight and hip hinge right now because it's going to help desensitize their pain. But once that pain has calmed down, it's okay for them to go back to flexing the spine again. So when I look at what is optimal movement to me is the strategy that allows you to handle the stress that you're about to place on your body and that doesn't hurt. And really it doesn't need to be more than that. Excellent. Because movement is everything. Posture is a shadow of movement. Movement's going to depict a history of injuries, and rehab is a critical element. There's so many people that have rehab programs. I'm curious, as a rehab expert, what do you think is the missing link in rehab?
I think that we do a good job of kind of pulling people back from the things that hurt them, which is definitely a big piece. So if somebody's going through a movement and it's continually kind of like they hammer their thumb and then they're sitting there just trying to like tap it lightly to make, and then hoping the pain goes away. No, like we do a good job of taking the hammer away, right? And we do a good job of building people back up. I think that because my background's in kind of a strength conditioning background, being a competitive power lifter and stuff like that, I think the biggest missing link that we see in a lot of rehab programs is maintaining fitness levels for the patient as they go through that process. So instead of just, if somebody has a patellar tendinopathy, we don't need to tell them, well, just don't do lower body lifts, just go upper body only. Because there's still a hamstring and a glute and a low back and everything else that kind of needs to stay in shape through that process. And if we're talking tendinopathy, we know that that's going to take 8 to 12 weeks minimum to get through. And so we want to maintain those fitness levels. And so finding the strategies for people to be able to maintain those fitness levels pain-free while you're kind of locally loading the more painful tissues, the ones that you're trying to build up, is a huge piece. And it gets insane buy-in from the client too, because your patient doesn't want to just stop. Your patient doesn't want to just rest. I mean, we know that. That's one of their biggest issues, right? Is they keep trying to power through a lot of things. So if we can kind of pull them back from the activities that hurt, but give them movement alternatives that don't hurt, that to keep them in shape, thinking like a Romanian deadlift where the knee doesn't really have to move that much, but the hamstrings can be absolutely hammered with that, then you're giving them an option to basically get in and do something without hurting themselves so that your process can then go on and be more successful. And you're going to get better buy-in for like that, just everyone just kind of buying into that whole process of, okay, this guy's on my side.
So let me get this straight. I really love what you're saying. I'm a big proponent of that also. I think the biggest problem is patients say I embark in a rehab, and even though the program is good, they're not fit. So you're a big proponent of rehab being based on getting that person into shape so they'll respond to the stimuli better.
I think it's just one piece of it. So I work with a lot of athletes. Mm-hmm. So if an athlete comes to me and they're in their rotator cuff, the front of their shoulder's hurting whenever they bench 250 pounds, well, if it's only hurting when they're benching 250, there's nothing wrong with me loading them at 225 just to maintain the shape of their pecs and their tris and everything else. But we're still taking the load off of that cuff or putting them into a floor press where the range of motion is going to be limited. So they're not stressing the front of the shoulder as much, but they're still hitting all of this other stuff. And that's going to allow them to kind of stay in shape a little bit. Now, if you have more of a patient that is maybe at a lower fitness level to start with, then their rehab, those like isometric holds can get them in shape. That can be enough of a stimulus to actually build their fitness level. So again, it's contextual that it's just like look at the person in front of you and make sure that if you're having someone who's coming to you already in a decent shape, you want to maintain that fitness level for them. And if you're getting someone who maybe isn't that fit, then your rehab is probably going to take care of that for them. It's probably going to get them and kind of just push them through that process as well. So these things can kind of overlap a little bit.
Outstanding. So you're clearly a rehab focused practitioner. We're chiropractors. So where does the adjustment or manual therapy fit into the treatment model that you've created?
To me, it fits in last. And the reason I say that is because the paradigm that I work under is I see my patients once a week to once every 3 weeks. And because I want to build a lot of self-efficacy, I want my patients to be kind of putting in the work on their own, not necessarily just be reliant on me to fix them. And so the results that I get with movement need to be reproducible. And what we know is that the adjustment, manual therapy, it affects neurology, right? It affects the brain's perception of pain, injury, movement, etc. And so if I'm going in and I'm manually kind of playing games with the nervous system before I go into movement, well, then it makes my movement results a little less reproducible every single day for that client whenever they're not with me, when I'm not there to be able to do that first for them. So what I will do is I always kind of lean on movement first. I get whatever result I need to get with movement first. I make sure that kind of my ducks are in a row with that, modify their activities, maintain their fitness levels, make movement technical corrections as we need to. And then from there, if they still just want some extra relief or they need some extra relief or you feel that it's warranted, once all of that is in place, then our more passive therapies, the adjustment, manual therapy, stim, ice, heat, etc., they can absolutely fit in there, right? But then at that point, though, you're not really like muddying the waters of the results that you got with your movement because you've already seen the results there. And then this next piece is like adding it's like the cherry on top. And that's how I do it. Now, it doesn't mean that I'm saying everybody has to do it that way. That's just the way I like to practice. And I get good results that way. I'll also say that though that the more acute someone is, the more their body's kind of in protective mode, the less movement options they have, right? Because their body's going to lock them down a lot sooner, and we're not going to be able to put them through as many movement options. So the passive therapies probably have more of more validity in those scenarios, to where the less the person can move, the more we can kind of lean on our passive therapies as a way to help like decrease their sensitivity. But as their movement options start to expand, I like to start to lean more towards the active therapies.
That's why we call it proven health alternatives, man. You're proven. I'm a big proponent of movement. Again, movement is a history of what's going on in their body, what they can do. We rely so much. How many patients come in and say, "Hey, can I get an MRI?" And now we've seen the literature's come out that the MRI really is just a complicating factor in most instances. It's not a structural, what's the generator of pain. The Lancet was great speaking to pain now. Pain actually being a sign of, as you alluded to, a protective mechanism in the body. Mm-hmm. So that's why you said if you don't go into the pain, into the threshold of pain, just up to it, it's going to have a totally different clinical outcome. So that's like leading edge, cutting edge stuff. That's great stuff. I'm a big proponent of movement like you're talking about. I'm going to ask you, what do you feel that's something that we as clinicians should focus more on when we're treating with patients? I have a funny feeling I know your answer.
Well, actually, the answer may surprise you because I am a very biomechanical guy. I'm a very stress, load, get stronger kind of guy. But I think the point that we actually should probably focus more on with our patients is that the psychological side. I think that we need to probably put more focus into the messages that we send to our patients, the things that we say, the narratives about how we kind of explain things. And I think that we should probably take a little more time to kind of explain context to people. I think that we do a good job. I think we do a decent job with the exercise. I think we do a decent job with the therapy side of things. But I think we can do better with how we explain things, because I see a lot of patients that have been, whether you're being told that this disc herniation is absolutely 100% the cause of your back pain, or, well, that hip misalignment is totally the cause of your back pain. And we just can't say that, right? Because it's such a multifactorial process. Or if we say, if you just tell somebody sitting is the new smoking, and you're very good, it's very well intentioned, and you tell your patient that because you're trying to get them to, really what you're trying to do is you're getting them to move around more, right? That's what you really want. You want them to just not get kind of stuck sitting at their desk for 3 to 4 hours on end. So we've promoted this narrative that sitting is the new smoking, when really it's just the lack of movement that's kind of not optimal for people. But that creates an image of this is really damaging my health. And if you say that to somebody, but they're like, well, I have to work an 8-hour desk job to feed my family. What do I do? I have to sit. And, now we created more anxiety towards someone's back pain sitting at their desk with our good intentions. It was totally well intentioned, but we may have created a negative outcome. We might have given them a little bit of a nocebo because of that. So I think we just need to have a better way of explaining things to people, and we really need to keep in mind the words that are coming out of our mouth, and we need to make sure that we're really explaining things fully for people so that we let them know, hey, it's okay that you have to sit at your desk at the day, but whenever you start to, feel a little achy, or if if you've been sitting down for 30 minutes, set an alarm on your phone, just get up and move around, because that it's not that sitting at your desk is really bad. It's just that movement's really, really good, and I like to frame it for people that way, that, it's your posture's not bad, but moving out of it every now and again is really, really good for you, and focus more on the positive side of things rather than all the negative side of things, because I don't want to put that anxiety and stress in someone's head, which we know can increase their sensitivity to pain. So that's the thing that I think we need to focus on more, is the narratives that we're kind of just preaching to people, just because I think it's going to lead to better clinical outcomes.
Great. I mean, I agree. I think the most effective doctors, like you and I lecture, we get to see a lot of docs, not just chiropractors, but doctors, are those who actually educate the patients, put out information, become a source of information. So with that being said, you got 450,000 Instagram followers. A lot of people following you, looking at your rehab. Let's take a minute. How'd you do it? Does it work for you? What do you say?
I think the thing that I've analyzed it for 2 years now. So in June, I just passed the 2-year mark of posting something every single day on Instagram, which in and of itself has been a huge piece of it, is just the consistency aspect. I think one of the biggest pieces, though, was I decided to meet people where they were at. And what I mean by that is I kind of dumbed down my information a little bit, because I was probably like a lot of docs out there. I was coming in, making a video, and I was kind of using our medical jargon a little bit. I was making the information just a little bit too advanced for someone who really has no background in what we know. And I think we really kind of, we almost forget about the fact, like, we know a lot. So what I started to do is I started to really just try and talk to in my videos, like I was talking to my grandma, and like I'm trying to educate my parents on how to exercise and go through this, and really just kind of simplify the message. And just, now there's all kinds of, like, there's timing, there's people may just like me, they may like the way I look, the way I talk, etc. They may like my demeanor. A lot of factors go into why I've been able to grow the way I've been able to grow. But if I'm trying to kind of put a recipe to it, it's consistency, meet people where they're at, and try and provide extreme value for people. So really just care. Like, get in and respond to every single comment, respond to every single message that you get, and just show people, hey, I'm here. Hey, I care. Hey, thank you for being here, and, giving me a piece of your time, because that's what they're doing. They're giving you a piece of their time. And like, all of us here know, I know, every doc here listening knows we're busy, right? Life is busy. And the fact that people are sitting down to give you a piece of their time to listen and, like, buy into whatever you're trying to say, like, to me, that's huge. So always keep that in mind, and I think you're going to be good.
I mean, that was great. I mean, I do a lot of Facebook, your Instagram, as you say, that's your jam. And it's time, like you said, and it's great that you're taking the time to educate people, and I'm sure they all appreciate that. So how can they get in touch with you?
So my main platform is Instagram. The handle there is at dr.jacob.harden, Harden. And y'all can probably hear my little 5-month-old son yelling in the background there. But Instagram at dr.jacob.harden. I'm also on Facebook, on YouTube. It's all the same handle, Dr. Jacob Harden there. My company is Rehab 101. If you guys are ever interested in what I have to say, what I want to teach, the email there is prehab101@gmail.com. And I'm happy to answer any questions anybody has.
Outstanding, man. It's been great. We got to do this again, no
Definitely.
doubt. I know I'm going to get to catch up with you later in the summer, and I really thank you a lot for taking time out of your busy day to share some of your key takeaways.
I'm happy
And
to.
let's get it on again. Dr.
Definitely.
Bob Silverman, always yours in health. We're on Proven Health Alternatives. We'll see you soon.